Well, for nearly 3 decades, Arizona has failed to provide the level of services for people with serious mental illnesses as dictated by state law. A recent audit of behavioral health services in Maricopa County indicates the quality of care may be getting worse. More on the audit in a moment, but first, David Major takes us to the state capitol where lawmakers gathered yesterday to learn about a lawsuit that continues to take shape and it continues to shape Arizona's system of behavioral health care.
This is a history lesson. I would suspect that there are not 8 people in this legislature that really understand the history of Arnold versus Sard.
It's a lawsuit filed in 1981 as the nation and the state were moving people out of mental hospitals into community-based behavioral health treatment.
Indeed, I'm sort of the institutional memory revolving around this case. I was the guardian as the Maricopa County public fiduciary of 600 people with serious mental illness.
As their guardian, Chick Arnold tried to help them obtain the community-based mental health services that were mandated by state law.
There weren't those services in place. And with that, I became one of the 5 named plaintiffs in the Center for Law and the Public Interest effort to fix that.
The case went all the way to the Arizona Supreme Court, which in 1989 affirmed that the state and Maricopa County have a statutory obligation to provide a wide range of services for the seriously mentally ill.
Over the course of the lawsuit, as far as services, money that has gone to services, it's been close to $2.2 billion.
2 decades and billions of dollars later, the lawsuit remains unresolved. Performance criteria required to end the lawsuit have not been met, and the company that manages Maricopa County's mental health system keeps changing.
I am Dr. Richard Clark, the CEO for Magellan of Arizona.
Magellan is the latest company selected as the Regional Behavioral Health Authority for Maricopa County. It was awarded a 3-year, $1.5 billion contract in September of 2007.
And we do believe that significant gains have been made.
But according to an audit conducted in 2008 by the court monitor assigned to the case, services are declining.
The court monitor compares the results of 2008 to 2006, which is a full year before Magellan even came into the picture. And so if one compares from 2006 to 2008, you can see a tremendous decline. But if you take a look from 2007 forward, you notice that there's been a significant improvement on 71% of the indicators on the priority class, ranging from anywhere from 3% to 46% improvement in performance.
The system really has degenerated quite badly, actually, since Magellan took over.
As a Maricopa County resident with bipolar disorder, John Hokanson speaks from experience.
I've had difficulty getting services. I had to fight for pretty much everything that I have right now. I have had to fight to get monthly doctor's appointments. I've had to fight to get into therapy.
He even had to fight for a case manager.
I went with 2 months without any contact at all from this case manager at all. And I didn't receive any updates to my ISP. It's called an individual service plan. It's supposed to list what services the client needs and everything. It expired. They didn't update it and everything.
Hokanson was able to fight for his rights, but he worries about people sicker than him who can't.
You know, it's one thing if you don't, if you know you're being hurt by this, and you don't know what to do, but there's people out there that don't even know they're getting hurt. So.
Meanwhile, John has quietly taken on the role of advocate, emailing his lawmakers, attending meetings like this, watching, listening, and waiting for the system to improve.
We're going to have to do something else here, okay? Just talk alone is not going to solve the problem.
Joining me to talk about the latest audit of Maricopa County's mental health system is court monitor Nancy Diggs. She's a past deputy superintendent of the Arizona State Hospital, and she has previous work experience with the Department of Health Services and ComCare, a predecessor to Magellan. Thank you so much for joining us on Horizon.
Thank you for having me.
You're the court monitor. What exactly does that mean? What do you do?
Well, the court monitor actually oversees the status of implementation against the court's orders. I actually report to Judge O'Connor, Karen O'Connor, who is the presiding judge in Superior Court, and it's my duty to monitor the expectations that in the court order and the court's orders and report to the court about the status of the class members in the case.
And how do you go ahead and report your audit here? How do you audit? Who's interviewed? How does that work out?
Well, we actually, I've used Dr. Jose Ashford. He's my expert out of ASU School of Social Work. And through a predefined process that has been agreed to by the health department, we randomly select in this year, we randomly selected 316 different class members that live in Maricopa County, and we use a pre-agreed to scientific protocol that involves visiting consumers, reviewing records. I just want to note that it's important to me that the system learn how to monitor itself. So 88% of my auditors this year were actually staff members at Magellan or staff members at the health department. I do that to teach people how to monitor the system and to control the cost at the Office of the Monitor.
With that in mind, what did the audit find?
The audit findings were very disturbing to all of us. We found that there has not been progress in the system. There's a variety of standards that were required by agreement of the parties, and there is significant declines since the compliance in 2006, and more importantly, there has not been any significant gains in the last several years.
We just heard from the Magellan fellow there, and he was basically saying that the audit was looking more at process as opposed to outcome. How do you respond?
Well, one of the things that we actually do look at is there a treatment plan and those kind of things. But more importantly, the most significant thing that the audit measures is exactly how is that individual doing in the community? Where are they living? What kind of services are receiving? Are they working? Do they have something meaningful to do during the day? Do they have friends? Do they have a social life? And how are they doing in their recovery from mental illness? And all of those things are the kinds of outcomes that you would look for when measuring progress in if people are getting services and are they helping them.
And that Magellan fellow has a name. It's Dr. Clark. And he also mentioned that you were looking too far back. You were looking back when Value Options was involved here as opposed to Magellan. And that if you just looked at 07 to 08, you would see great improvements.
Well, I think the point of the audit and how I would respond to that is the purpose of the audit is not really to measure the performance of either Magellan or the previous contractor. So in that sense, I'm not measuring, not comparing their performance. What I am doing is measuring for the court how the defendants in the case are doing and how the consumers that are supposed to be served are doing in the system. So that's how I would respond. In some cases, there might have been 1 or 2 percentage points improvement since last year, but the point is that, for example, 90% of the most ill people were supposed to have a well-written treatment plan that described the services and supports they needed, and the audit results found that actually less than 15% of the people had a treatment plan. So the audit also indicated of the non-priority population, 80% of them were supposed to have their needs met according to their treatment plan, and the audit found that less than, I think it was less than 15% of them actually were having their needs met. So I use the standards that are required by the court that the parties have agreed to.
In your report, it mentions that a complete overhaul is necessary. Why? What is wrong with the system now? Why are those results that you found, why are they there? The system's in place. What's going on?
Well, we've had two different companies since, I think, for the last 9 years. Clearly, things are not improving, even though there has been additional funding over time. In fact, the services and the supports delivered to people are actually getting worse. And the bottom line is people with serious mental illness really depend on this system of care, and they're really suffering right now. And I believe that through the leadership of the new governor, that the community can come together and with the stakeholders and really take a look at how the system is designed, are there fundamental flaws, and what needs to happen to improve the system so that people that really need the services are actually getting the services.
All right, very good. Nancy, thank you so much for joining us. We appreciate it.
Thank you.